Alright, I'm going to demonstrate clean needle technique so that all of y'all that are watching this that are freaked out about going to the acupuncturist because of the fact you think that you're going to get a disease or the needles are never used or always used, repeated, I'm just going to show you what proper is. So if you do go to an acupuncturist and they're using proper technique, you at least know that you're going to a decent person. Alright? Isopropyl alcohol, it's got to be 70% and above. No problem with alcohol, okay? That cleans the point as well as what is required by the state of California and the national license as well. Alright, so we're going to take our alcohol, get a cotton ball. Sterile cotton ball is fine. Non-sterile is also fine, but if you can, get a sterile cotton ball. Clean the point that you're going to use. Point should be cleaned. If you're a patient, of course, this is what you want. You want every point that you have on your body cleaned before the actual needle is inserted. Then, you take your needles, open the needle up. The acupuncturist will open a pack of needles. He should be opening a pack of needles each time. So, in this case, I have 10 needles in this pack. Okay? 10 needles. All 10 of these are clean, never been used before. Now, the pack is open. These needles could only be used on this patient here. Needle insertion, do not touch the area after the alcohol has been on. Tap, needle is placed in. That's acupuncture. That's clean needle technique. That's what you should be getting as your acupuncture. Alright, I wanted to show you today the different size needles that may be used in an acupuncturist office, particularly the ones that we use here. So I'm going to take this patient's arm and I'm going to show you 4 different size needles that are going to go in, all right next to each other. Okay, again, this is just to disarm all of the psycho fear of needles. These are not hypodermic needles. They're really tiny. No pain at all. Getting back to the arm, I'm going to show you the different size needles. First off, the 1/2 inch needle. Very, very, very tiny in length. Again, all of these points have been cleaned. I've already cleaned her arm, so I've demonstrated the clean needle technique here. I've already cleaned the arm for this treatment. This is actually a 0.18 in diameter, 30 millimeters in length. See? Just a little bit larger than the other one. These are the most common used on patients. And then we get a little bit longer, 0.20 millimeters in diameter and 40 millimeters in length. This is used for a little deeper or larger area of the body where there's more tissue. If you want to get to a muscle that's been damaged or weakened deeper deeper underneath, say in the gluteal region or in the leg, then you're going to use that. And then the final needle is 0.25 diameter of a millimeter and 50 millimeters long. Those would be the 4 different size needles that are quite the most commonly used in practice. That's what we use here. Okay, the needle that I've inserted here on this patient is actually a needle that is only 0.10 in diameter of a millimeter, a tenth of a millimeter in diameter and a 1/2 inch long. And you'll see as I pull this needle out, I use cotton, cover the point. That's how tiny the needle is. Look at how her small thumb is compared to that needle. Very, very, very tiny. I wanted to show you one last thing. As we take the needles out, each needle goes into a biohazard container. No, they don't go on the trash can. No, they don't go on the floor. Sometimes. But really, no, they don't go on the floor. No, they don't go outside where kids could step on them in the grass. All of them are placed in a biohazard container that is then sent out to a medical disposable place when, of course, that container is filled. Okay, once again, this is all about ending the fear of what acupuncture is. Okay? Take care. Have a great day.